Today, let's talk about Acanthosis nigricans. This is a condition where we notice pigmentation and thickened skin, typically around the neck, the underarms, the groin areas, and sometimes behind the knees. I am seeing it in my practice very commonly now in young adolescent teens. And the worry here is that subsequently it can lead to a pre diabetic condition. So let's talk a little more about what this is, why is it caused, and what can we do to treat it or reduce it. As we are, following a very sedentary lifestyle now, thanks to the pandemic, we're noticing that increase in weight, especially in young children, is very common. And this increase in weight and subsequently leading to obesity is causing extra insulin to be produced into the system. So the body is flooded with insulin. Now, what happens is when this insulin passes through our skin, that is the dermis, and then the epidermis, it crosses the middle layer, the layer in between the epidermis and dermis called the basal layer, which produces and which has something called melanocytes. These melanocytes then produce melanin. So when insulin passes through this, when it comes to the epidermis, it then selectively attaches to the insulin receptors, which cause the skin cells to produce excess cells. So you have the keratinocytes and the fibroblasts producing more skin tissue. This then is seen as pigmentation and velvety skin in our folds. What do we do to reduce this? The first thing that all of us need to remember is reduction of weight. When we reduce weight, the body is then not flooded with insulin. Insulin sensitivity then reduces, and we can reduce the glycemic index of our body. That will not stimulate the skin cells to produce excess skin tissue and reduce pigmentation. So reduction of weight is most important. Many a times it's also associated with something called polycystic ovarian disease in young girls. So ruling out a PCOS by doing an ultrasound of the ovaries really help. The other thing that we can do, to reduce the pigmentation and thickening of skin is take vitamin A derivatives. These are retinoids. Either take them orally or topically. Remember, when applied topically, you should use as a retinol sandwich. So you apply the moisturizer first, then apply retinoic acid, and then put a moisturizer once again. So this reduces friction. As you all know, friction also leads to pigmentation. So we need to treat the skin gently. The other thing possible is lightening creams, which reduce the effect of melanocytes and reduce pigmentation. You need to apply a moisturizer daily. Dry skin again causes pigmentation. Acanthosis nigricans, therefore, should be considered more as a systemic disease than just a topical skin problem. I really beseech all parents and young adults to understand the causes of this and prevent it from happening rather than go and treat it subsequently. Check your diet, work on your body, look at doing interesting exercises which keep you busy and reduce the reduce your calorie intake when you eat, as well as utilize those calories in form of exercise or any physical activity. Going back to sports, learning a new dance actually should really help you get back on track. I know this pandemic has caused a lot of changes in our lifestyle, but we need to look further and prevent disorders and diseases which can be prevented by a healthy lifestyle. I hope this has answered some of your questions of acanthosis. For anything more, you can always write to me on my Instagram page or on Facebook, or you can call us anytime. Thank you.